Hi, my name is Chris Pruvey. I'm a musculoskeletal physiotherapist, having qualified in 2003. I went on to do formal postgraduate qualifications in musculoskeletal ultrasound, non-medical prescribing, and I have a master's in sports and exercise medicine. A lot of my work comprises not only the physical examination and history taking, but actually delivering diagnostic ultrasound scans to diagnose musculoskeletal and orthopaedic conditions, as well as providing ultrasound-guided injections for pain relief. So the first part of my job is having a discussion with any other clinicians involved in patient care and the patient themselves in terms of what their goals are, what the history of the problem has been, to get an idea about what we might be dealing with. At an appointment, what I'll do is provide a normal physical examination, the sort of thing that you would have if you visited an orthopaedic clinic or a physiotherapist. This will give me an idea about what to scan and what might be going on further before we deliver the ultrasound. I'm more than happy to answer any questions, and on my website you can book in for a free telephone conversation about your problem to see if an ultrasound guided injection or a diagnostic scan might be of help. Now, after we've had a good conversation about the history of the problem and performed a physical examination, we'll then move on to have a look at the joint or tendon or body area with a diagnostic scan. Most people have seen ultrasound within various medical departments in their life. It's only in recent years it's being used more and more within musculoskeletal and orthopaedic disorders to diagnose problems there. So, essentially it works in the same way. A probe, an ultrasound probe is used, and we have a look at the area via some ultrasound gel which transmits the signal. You can see on there, that's my wrist joint, and what you can do is move things under dynamic kind of imaging. So I can have a look at tendons, I can have a look at bone, and here are some examples of some diagnostic scans on your screen now.
So the first example is a heel bursitis or a retrocalcaneal bursitis with a thickened and inflamed Achilles tendon. So you'll see the heel bone as the curved white line in the left-hand corner of the screen. The Achilles tendon sits on top of that, running left to right, and the heel bursitis can be seen as the darker shadow just to the right of the heel bone. The ultrasound machine travels up through the Achilles tendon away from the heel bone. It then switches angle and we track the Achilles tendon back towards the heel, and you can then see the Achilles tendon in a transverse plane with the retrocalcaneal bursitis just sitting under that again here. So the second example is an ultrasound of a subacromial bursitis, a shoulder bursitis. In these images, you can see the top of the arm bone, the humeral head, just on the left-hand side of your screen as a white line, and the supraspinatus tendon lies on top of that as a beak-like structure. You'll see to the right-hand side there's a dark space, and that is fluid from the subacromial bursa, which you'll be able to see overlying the supraspinatus tendon and overlapping into that space. So the final example is that of a quadriceps tendinopathy. So on the right hand side of the screen as a white line, you'll see the top of the kneecap, the patella, and the quadriceps tendon towards the left, which inserts into the kneecap. At the junction of the tendon and bone interface, you'll see some disruption to the cortex, the outline of the bone, and this is representative of an insertional tendinopathy of the quadriceps tendon. You'll see here as the probe spins, you'll see it in a transverse view, and you can see quite clearly the disruption to the bone interface.
So if we move forward with an ultrasound guided injection, there's really two types of injection that we might do. One is a corticosteroid injection using either triamcinolone or depomedrone. Often we'll combine this with putting some local anaesthetic in. If it's a deep joint, for example, we'll use local anaesthetic to reduce any pain during injection as we enter the joint or tendon, but often it helps to bulk out the medication and spread it round a joint or through a tendon sheath. So it depends on what we're looking at. The other thing we can inject is a substance known as hyaluronic acid or sodium hyaluronate. Essentially, this is a naturally occurring gel substance found within tissues of the body, and it's got anti-inflammatory properties, but also it reduces friction in and around tendons and joints, so it can be useful in that regard. So how is an ultrasound guided injection performed? Well, we essentially use the ultrasound to guide the needle to target the area of pain. If this is a joint, then we'll target within the capsule of the joint and we'll visualize the needle going through the capsule. If it's a tendon sheath, similarly, we'll make sure the injectate is aimed within the tendon sheath. So it should be more effective and it's safer than an unguided injection.
So in this knee ultrasound guided injection, you'll see the kneecap, the patella, in the top right hand corner of your screen, and the leg bone, the femur, in the bottom left. And this dark area where the needle can be seen entering is the joint cavity, and you'll see the injectate flowing in the joint. Sometimes when delivering an ultrasound guided injection, it may benefit the patient and the clinician to use what is termed an out of plane technique. Essentially, with an out of plane technique, we place the needle in from the side of the probe. So we're just looking for the needle tip to poke through the center of the screen into the joint cavity or the tendon sheath. And this big toe joint injection, you'll see that occur at the bottom of the joint cavity and fill up the joint cavity and expand the joint cavity with the injector. This is an example of a subacromial bursa injection on the same patient that we saw earlier for the diagnostic examples. So you'll see the needle being placed from the left-hand side of the screen into the subacromial bursa, and the subacromial bursa expanding with the injectate.
So in terms of the basic steps of an ultrasound guided injection, we'll draw up and potentially mix some syringes with local anaesthetic, steroid, or the hyaluronic acid, the sodium hyaluronate. We'll get the machine ready and get you in a comfortable position. We'll then disinfect the skin area. Sometimes we use alcohol sterets, such as these, or sometimes larger tissue wipes called chlorhexidine wipes to disinfect the area. We'll then place sterile gel on the area and place our probe in situ, okay, so we can see the area to be targeted. In terms of after the injection, we'll wipe the surface and we'll just put on a plaster. Now, if it's deemed that a corticosteroid injection or a hyaluronic acid injection might be helpful for your joint or tendon complaint, we'll always run through a consent form explaining the relative benefits and risks. The risks are very, very minimal and can be found on the website in full. But essentially, the main things to consider is a very small risk of infection. Normally in studies this is documented about 1 in 10,000 to anything to 1 in 70,000. There's a tiny risk of allergic reaction to the medicines we use, which might be local anaesthetic or steroid, and in this case we'll screen you for this. Other very, very small side effects can occur which are documented on the website. So have a look at that.